En 2013, maybe
In 2013, je fais ça,
characteristic of that language, which makes it more explicative. En 2013, 28 presentations.
In 2013, 28 presentations were delivered in person and 4 via webinar for a total of 273 attendees. The main themes were documentation standard, professionalism, and working collaboratively. NANB recognizes that webinar offerings are often viewed by groups of nurses, therefore increasing the reach of these programs, and these numbers are not always captured in registration and attendance statistics. To further engage members, a survey was launched in early April 2013 to promote the association's regulatory role and determine how to best support RNs and NPs' understanding of that role. Approximately 1,225 nurses completed the survey, and thank you for that effort, and the findings were summarized and published in the September 2013 Info Nursing. In 2013, NANB organized an invitational forum in conjunction with its May 2013 AGM to engage membership and key stakeholders in discussing professionalism and professional presence in the nursing profession, with Ross Moore, Chief Nursing Officer of the Scottish Government, as guest speaker. And the invitational forum brought together 250 participants. These initiatives not only served to support the practice of nurses, they also serve as a means to consult them and discuss issues they view as being important. I think we have some pictures. Print and online resources include NANB's e-bulletin, The Virtual Flame, which is distributed to approximately 85% of our members 4 times annually. And I underscore the reason for that. It's not 100%. Is that you have to provide us with your good email address. If we don't have your good email address in your profile on NANB's website, it's impossible for us to send you the virtual flame. Please make sure that your profile is updated. But in the last 2 years, there's a big increase. Jennifer, we started with about 60% of our members.
This communication tool supports members through direct contact, providing important and timely information while continuing to support the association commitment to the environment. Members wishing to receive resources in an electronic format only can do so by advising the NANB Communication Department. And I ask you to please do that. Maintaining your NANB profile ensures the Nurses Association of New Brunswick has an up-to-date email address at all times to support timely communication. In 2013, the Nurses Association of New Brunswick initiated work on the development of a 3rd e-learning module on the subject of professionalism in nursing. I would like to mention here that the module titled Committed to Care, Committed to Professionalism was launched in April of this year. Nurses Association of New Brunswick also offered 4 webinars in 2013 on the topics of documentation, managing RNs with significant practice problems, civility and the CRNE, and NANB registration process. Webinars, conferences, and annual meetings are recorded and archived on the Nurses Association of New Brunswick website, allowing nurses to access the materials at their convenience. Finally, the virtual forum is a means to engage in discussion on a specific subject matter between RNs and a content expert via Nurses Association of New Brunswick website. A discussion on RN prescribing was launched in November 2013 for a 3-week period. And we just announced this morning, in fact, that this fall, Sherry Graydon will also be our expert for a specific subject matter. The Nurses Association of New Brunswick welcomes your suggestions for articles and items. Your input is always valued. A considerable component of the Nurses Association of New Brunswick's capacity is focused on the creation and revision of support documents for nurses. The Nurses Association of New Brunswick continually strives to ensure nurses have access to the most current, evidence-informed documents to guide their practice. This slide shows the new and revised documents for 2013. These documents are available at the NANB table in the foyer for your consultation. All NANB documents, virtual discussions, webinars, and e-learning modules are available online through the Nurses Association of New Brunswick's website.
On NANB's professional conduct processes in 2013. NANB utilizes a 3-pronged approach to regulation: promoting good practice, preventing poor practice, and intervening in situations where practice is unacceptable. As previously highlighted, NANB promotes good practice and prevents poor practice by setting and promoting standards of education, registration requirements, practice standards, and by supporting nurses in meeting those standards. Intervening through the complaints, discipline, and review processes is a measure of last resort and is taken when standards are not being met and public safety is compromised. 17 complaints were received in 2013. Complaints lodged in 2013 were from hospitals and nursing homes. As already mentioned, the formal complaint process under the Nurses Act is generally a measure of last resort. The overwhelming majority of concerns and issues related to the practice of nurses are resolved at the institution or agency level. NANB provides consultative services to members, the public, and employers on how best to address concerns related to a nurse's practice or conduct on a continual basis. Complaints related to any ailment or condition rendering a nurse unfit, incapable, or unsafe to practice are referred to our review committee. So I want to make that distinction. We recognize that there are health issues that impact practice, and they go to review committee, whereas issues of competence, et cetera, will go to the discipline committee. All go through the complaints committee. Complaints related to professional misconduct, conduct unbecoming a member, incompetence, dishonesty are referred to the discipline committee. 11 discipline and review committee hearings took place in 2013. Detailed reports of all the committees are included in the annual report, as well as information about the nature of these cases. And it's important to review that because it gives you a little insight maybe into your own practice or areas to pay attention. I want to underline, because I reacted to that when I was reviewing things and preparing last night, this list is not in an order of importance or not in order of the number of complaints we've received. I verified with staff this morning, and incompetence would be probably the largest group. Again, remembering there were 13 complaints, which represents way less than 1% of our membership. Theft of narcotics, substance misuse, professional misconduct, falsifications of records, etc. Those are all the nature, you know, it's unfortunate when we see those things, but we have the responsibility as peers to react, to create some response, to talk to the individual, to talk to our manager in the workplace, and then if necessary, report those things to NANB. That's how we maintain public trust, and that's how we maintain the credibility of our regulatory work. NANB's mandate also concludes the promotion of healthy public policy. NANB priorities are established in NANB ends or objectives and include advancing the social determinants of health and principles of primary health care, practice environments that support safe, competent, and ethical nursing practice, and health human resource planning. NANB collaborates in provincial and national initiatives that have an impact on nursing practice and the welfare of New Brunswickers and Canadians. Advancing primary health care has been NANB's agenda for the past 3 decades. During 2013, NANB continued to be active member of the provincial government's Primary Healthcare Operations Service Committee and Steering Committee. We had been part of the committee that developed the primary healthcare framework, and we've been active on the 2 levels now, seeing that framework brought forward. The Operations Service Committee for Primary Healthcare was tasked with developing operational guidelines for the implementation of family health teams and the development of an accountability framework to measure family health team outcomes. The committee completed its mandate and last met on January of 2014. The Steering Committee's mandate is to direct and oversee the development of the Primary Healthcare Framework for New Brunswick, which was released in August of 2012. Transforming primary healthcare delivery in the province will be a challenging undertaking that is long overdue. NANB will continue to participate on the newly constituted Primary Healthcare Steering Committee as work towards implementation of the framework continues. The purpose of the Provincial Nursing Collaborative is to provide informed and expert advice to the Department of Health on priority nursing strategies and policies that affect nursing and healthcare in New Brunswick. The Provincial Nursing Collaborative has representation from all sectors of nursing in the province, and its agenda is focused on strategies to sustain and assure a nursing human resource as required by our province. Over the past 3 years, NANB has worked collaboratively with a number of health professional regulatory bodies to establish a voluntary network to facilitate a communication forum and enhance the regulatory capacity and practices of all health profession regulators in the province. Priorities for discussion have included the assessment of candidates, integration and mobility of international applicants, legislative, disciplinary, and operational processes. I'm very excited about that piece because I think it will help many of the smaller groups in a province our size. In 2013, the NANB continued its engagement with the New Brunswick 2026 Roundtable. The Roundtable was established to provide a forum for New Brunswick stakeholders to engage and mobilize in advancing the future sustainability and success of our province. Early on, the Roundtable identified learning as a tool which has the most potential to make a sustained and ongoing difference in the engagement and success of individual New Brunswick citizens and our province as a collective. A provincial forum was held in the fall of 2013 to profile the contributions of individuals and groups working in this area and to highlight some of the current challenges New Brunswick is facing in relation to learning and literacy. The Nurse Practitioner Review Working Group was established by our Provincial Chief Nursing Officer to review the implementation of the NP role in New Brunswick with a goal to optimize the utilization of nurse practitioners in our province. The working group is composed of the CNO, representatives from both RHAs, the NANB, the department, and nurse practitioners themselves. In November of 2013, NANB delivered a virtual presentation to a 6-person delegation from Haiti. The presentation focused on the association's mandate and the nursing school approval review process. They were very interested in that. The Canadian Association of Schools of Nursing hosted this tour in Ottawa for delegates from the government of Haiti. NANB participated via teleconference and internet by providing a presentation and by answering participants' questions. NANB was the only Canadian nursing regulator to contribute to the 6-day study tour. Representatives from Haiti were seeking an opportunity to link with French-speaking Canadian nursing regulatory body to enhance their knowledge in the area of professional and nursing regulation. The value of CNA's certification programs is quite evident in New Brunswick. As of July 2013, there were 660 registered nurses in New Brunswick with CNA certification in 19 different specialty areas. Could anyone in the audience that has a CNA certification raise their hands? Congratulations, that's wonderful. Additionally, New Brunswick nurses continue to contribute to the development and maintenance of these programs. Our NANB president, in her role as a director of the Canadian Nurses Association, is collaborating with CNA leadership and staff to advance the revitalization of CNA as CNA's compliance with the new non-profit organizational federal legislation moves forward. The Canadian Council of Registered Nurse Regulators, the CCRNR, was established in 2011 to promote excellence in registered nurse regulation and to serve as a forum and voice for provincial, national, and international regulatory matters. We're almost at the end, guys. And I want to underline, nursing was one of the last professional groups to establish a regulatory council, a national regulatory council. Ongoing work has focused on the maintenance of national RN competencies, RN and nurse practitioner mobility. The example I gave you earlier was the Nurse Practitioner Practice Analysis Project and the transition to the NCLEX RN exam. In closing, I believe it's only fitting to focus on NANB members. And I want to highlight those who were recognized in 2013 at our awards celebration. The following RNs received the following awards. Award of Merit in Education, Dr. Rose McCluskey. Life Membership Award, Lucille Offrey. Award of Merit in Administration, Suzanne Robichaud. Excellence in Clinical Practice Award, Sherry Gionnet. Award of Merit in Nursing Practice, Liette Mainville. Awards are given biannually, and nominations for the 2015 awards will be solicited in early 2015, so please get your thinking caps on. Thank you, Madam President. That completes my overview and highlights for our 2013 operational year.
Thank you, Roxanne. Before I open the floor for questions, I would entertain a motion for adoption of the 2013 annual report.
Annette Leboutillier, I so move.
Thank you, Annette.
Amy McLeod, I second.
Thank you, Amy. So we have a mover and a seconder. I now open the floor for any questions in respect to the annual report. Comments, questions? Roxanne is humble, so I'll just add a few myself. I had the pleasure of giving Roxanne her performance evaluation, and she has shared, I'm not sure if we shared with our members yet. Of course, we'll say more next year, but Roxanne plans on retiring in 2015, and it was a pleasure to give her her evaluation this year. And as you can see with the staff of the association, the work that gets done over a year is amazing. The professionalism of the staff, all that goes on behind the scenes. Until you sit at the board of directors and receive all these reports, it is amazing what gets accomplished with the few staff that we have in the office, and how professional and diligent they are, and commented on the fact that we have such a good working relationship with the government. We don't necessarily agree with everything that's happening, nor I don't suspect that they expect us to agree with everything that's happening, but the fact that they invite you to the table and value your input, which is all because of the leadership that we've had at the office. So.
Darlene knows I always have a comment. It's absolutely a privilege to have done the work I've done. I always get emotional when I talk about things I care about, but I always talk through it, and I'm going to be fine in about another 10 seconds. The work that I just reported is a team effort, and I want to thank the team at NANB, and you need to thank them as well. Thank you.
To the report or any further information, because as you can see, a lot has happened over the last year. We're coming to the end of our present strategic plan and have formulated another one, which we'll talk about in a bit. No? Well, I have a motion on the floor. Oh, yes, go ahead.
Thank you, Marilyn.
Microphone number 2.
Marilyn Quinn. Thank you, Roxanne, for your report today. My question was around the number of members, and you alluded to the fact, and I believe Darlene mentioned it in her opening comments, that we are seeing a slight decrease. And I guess we have the benefit of seeing from 2011 on, but over the history of NANB, have we seen this decline over the years, are we, when looking at other jurisdictions, because I know for the Nurses Union, we've seen our first decrease in a number of years. And, we live in a province where we have a declining population, but we know we have an aging population. So, when we line up the numbers, one doesn't necessarily mean that we'll need less nurses. We may actually need more. So just, I would be curious to have your thoughts on that, please, Roxanne.
We have actually, over the last 2 decades, saw a very slow but a gradual increase in numbers. And I think when we talk about the numbers changing a little bit, is we're seeing maybe 100 less members, maybe 80 less members. It is concerning to us, and certainly Mary held a nursing collaborative meeting last Friday. All the stakeholders were there. And when you say that 40% of the workforce is 50 and over, you have to accept the reality of what that means. There have been a number of positive initiatives in New Brunswick that have helped retain nurses in the workforce. One is the senior nurses adjustment that you were able to negotiate that kept people in the workforce. And so I think there's been a number of initiatives in New Brunswick that, with the additional seats, with those things, we've been able to better stabilize the workforce. What we need to pay attention to now, and I know of Mary's commitment to that, and we are all committed to making sure that happens, and we talked about that in our political priorities this morning, to ensure that we continue that dialogue, that all the important stakeholders are there. It's very hard to say, and the 2 CNOs are members of that group, and they're very much watching what's happening within their work. There's representatives from long-term care there. We do know that there's going to be changes in the production of registered nurses with the recent announcements from UNB. So really the only thing that will make a difference to ensure the capacity of the workforce is if the system transforms, right? If we were to build a cancer institute, we probably will need 500 more nurses to staff that 24 hours a day. If we reduce facilities, we may not meet as many, and that may not have the same impact. So it's very hard to do that. The one thing that NANB continually thinks about is, and especially in relation to our nurse practitioner workforce, we need to ensure we can maintain our educational programs and the quality of them. And the reason we need to do that is when we look at our New Brunswick workforce, it's 80%, 85% New Brunswick nurses. We do have some nurses who come from Ontario and Quebec and Nova Scotia, and we have very few international nurses. They make up less than 1% of our total workforce. So we have a domestic workforce, and clearly, I don't think we believe people will exit British Columbia to come to New Brunswick to work, right? So we need to be very aware of that as well. So thanks for your question.
Thank you, Roxanne. And I think you highlighted a second part of my question with the number of pending retirements. And I think it's incumbent on all the organizations, and I know we're working through the Nursing Resource Collaborative, to be able to target, or at least to have some sort of estimate or best guesstimate as to future retirees. And we know currently nurses in the system have to give their employers, 1 month's notice. The concern is that when 25% of your workforce are in that zone, and if everybody decided within a 6-month period that it was a 1-month notice, we've taken it upon ourselves to start talking with members about the importance of signaling to your employer ahead of time. Once you've made your arrangements around pension, we're surveying our members again in a very short time. It will be one of the questions that we're asking, and we need to raise it as a discussion because it's important for employers to be able to know, to be able to do the appropriate succession planning. And I think, when we see the number of graduates, we all know the precarious position we may find ourselves in. The question only, is always, will it be in 1 year, 2 years, or 3 years? So, I'm proud of the work that we're doing at the Nursing Resource Collaborative, but I think every time I see the numbers in front of me, I think it sort of only impresses upon me the urgency that we need to put a plan into place to be able to know that we can backfill those positions, or we'll become, in the midst of a worse sort of shortage than we've seen for some time.
I agree, and thanks for those initiatives. The other thing I would say about nursing resources is And it may be my fatigue, it may be the time of day. What's the little guy who called wolf? And I think our nursing profession is suffering some of that because we've had surpluses and deficits with people in the room with 40-year career, with those of you, it's always a backstory in our nursing profession, right? And certainly the numbers were very different 15, 20 years ago. But there were, luckily because of the work of the National Advisory Committee on Resources, there were initiatives. And we have felt in our efforts that there's fatigue around that message, and we need to shape it in different ways. And you and I have shared these conversations, right? And so the other thing I would share when you're saying about advising nurses to let their employers know, one of our board members indicated that she sees a lot more people going, she phrased it, with their brown envelope to human resources to have a consultation. And so that may be a signal as well, if human resources isn't communicating that, what may be transforming. And I don't know if you could share, Marilyn, but I always think as well that we're at a transition period for those unionized nurses, which is still the majority of nurses in New Brunswick. Pensions were established at a certain time, maternity leaves benefit, and I think we're getting a new cohort that has a better funded pension plan that could have impacts.
Yes, and from the statistics, because I do chair the pension plan for nurses, we know that the cohort that's coming now has 25 and 30 years of service. That's the cohort that stayed in the workforce. It's been the previous ones who had broken service, and they had went casual, part-time, full-time. But even with the changes in the pension plan, those aren't the nurses that are going to continue to work longer. So it's a decision that they're making, on a yearly basis. Some of them are checking it out on the calculator, looking at it, 4 months from now, 8 months from now, and it's around being able to alert employers so we can do the appropriate succession planning, so that we, if students are here in the province before they leave, because as you said, bringing them back to the province will be more difficult. So, there's lots of work to be done in that area, and I'm glad that we're able to work together on some of those things. And personally, Roxanne, I'd like to thank you for the leadership you've shown at NANB and in the nursing community in this province. Thank you.
Thank you, Mel. Very kind. I'm not gone yet. I'm staying. Thank you. Remember, I cry really easy. Thank you. The other thing I could share too that's positive is we now have a phased initial registration fee, in that if an individual's not certain they're going to be staying in New Brunswick, they pay the fee for the non-practicing registration so that they're in the queue to write the exam. And then if they stay, they will ask for a refund of that and pay. And we've had individuals that didn't expect to get work come and change that because they're getting offers of work. So that's positive as well.
Great. Any further comments or discussion? No? All right, then we have a motion on the floor. All those in favor of the motion? Contrary minded? Abstentions? The motion is carried. Thank you, Roxanne. Now, I was informed I don't believe we have any more resolutions. I just want to correct that before. No? Okay, thank you, Paulette.